Hey everyone, Kelly here, lymphedema and oncology physical therapist. In past videos, I have spoken about different myths related to cancer as well as breast cancer and what is true and what is not. Today in this video, we're going to talk about 3 different myths related to lymphedema. Now this is part 2 of a 3-part series, so if you want to see the other videos, I will link one up above and be sure to subscribe down below to see when the next one comes out. You can also follow along with us on Instagram as well as on our website for more content and information related to oncology and lymphedema. If you have any other myths or things that you want to hear more about in future videos, be sure to comment those down below. But other than that, we'll get started. So the first myth we're going to talk about today is all compression is created equal, or similar to that, wearing some sort of compression is better than wearing no compression. These are false. Not all compression is created equal, and actually there's a really big range in the different types of compression. There are 2 main different kinds. There are compression stockings or sleeves, and there are Velcro wraps, and we'll talk more about Velcro wraps in a little bit. But when it comes to stockings or sleeves, or even compression shorts, compression tank or bra, there are 2 main kinds of compression. There are the circular knit compression. These are an off-the-shelf kind, meaning you can buy them in a size small, medium, large, extra large. And these are great for someone who has mild edema or mild swelling, but these are not great for someone who has more moderate to severe lymphedema. Someone's going to swell right through them and they're not going to work really well at all. Someone will then want to wear a flat knit garment, which is the other kind. These are more custom garments. They are considered an inelastic garment, meaning they don't have as much stretch, but they do a fantastic job of containing swelling and containing lymphedema. All of these, or these kinds, there are so many different brands and styles out there, and I have done another video talking about the different types of compression garments, stockings and sleeves, and I will link that up above or down below that you can check out further. But in general, the different levels come in millimeters of mercury of pressure, which is how much containment or the tightness they are. The off-the-shelf will come in something like 20 to 30 millimeters mercury of pressure, which is a standard medical grade, or 30 to 40, which is strong. And you'll hear the flat knit garments come in something like class 1, class 2, class 3, class 4, which relate to the other kind. That's just how they have it all built out and written out. So again, there are 2 major kinds. They are not equal at all. Now, if someone has lymphedema and, like I said, they're trying to wear an off-the-shelf stocking and it's not working, not only is it not going to contain their swelling, they also might make their swelling worse, because these can cause more of a tourniquet effect, meaning if someone's shape or size or amount of swelling isn't going to fit these perfectly, they are going to get restricted. It's kind of like a rubber band around that part of the limb, and that can actually back up the swelling even worse or even more. So it is very important to make sure someone's in the right kind of compression. If someone has a hard time getting on the compression garments or want something more day and night, they can look at doing a Velcro wrap, which comes, this is a lower leg piece. They come for most of the limbs or every part of the body, and they are easy to put on and off because they Velcro. You can tighten them up, you can loosen them up for a different amount of compression, but they are just another really good option, and I will link options for all of these down below that someone can check out further. The next myth is water pills can reduce lymphedema. Lymphedema is not water weight. Let's say it again together. Lymphedema is not water weight. Some individuals and even doctors believe that by taking a water pill that someone can reduce their swelling from lymphedema. This is not true. Diuretics or water pills will not reduce lymphedema. Lymphatic fluid is a protein-rich fluid that comes from the blood, but it is uptaked into lymphatic vessels and lymphatic nodes through the lymphatic system. And what lymphedema is when there is a dysfunction or a obstruction in the lymphatic system causing the backup of swelling. Now, diuretics mainly reduce fluid from the blood vessels, but these are separate from the lymphatic vessels, and diuretics do not help the lymphatic vessels. And so the question is, why do diuretics work for some people to help reduce their swelling in their legs? Well, those individuals likely do not have lymphedema and likely have fluid or swelling from a different kind of edema. Not all swelling is lymphedema. Edema is diagnosed based on the primary condition that causes it. So for example, if someone has a vein issue, we call it venous edema or venous insufficiency. That is not necessarily lymphedema. Someone needs to work with their doctor to get different testing done to help diagnose exactly what kind of edema or swelling someone has. But if someone has lymphedema, diuretics and water pills are not going to be beneficial. Really, what needs to be happening is that doctors need to be looking at the diagnosis and the cause of someone's swelling and then prescribe the medication based off that diagnosis. So again, this myth is false. Water pills will not help reduce lymphedema. And the last myth that we're going to talk about today is lymphedema and swelling are caused by eating too much salt or drinking too much water. Nope and nope. Both of these are not true. Yes, if someone has a lot of salt, they are going to retain some fluid for a couple of days. But once they lose that fluid again, they're going to go back to the same volume. Lymphedema is caused by a dysfunction of the lymphatic system, like we just talked about in the last myth. And so eating too much salt is not going to further damage the lymphatic system. Someone may seem or feel a little bit more swollen for a day or two, but again, once they lose that fluid retention, they're going to go back to the same volume. So although it is great to eat healthy and not have too much salt in general for health, it's not going to greatly affect the lymphatics. The only piece of this that someone needs to consider is that there is a high correlation with worsening of lymphedema or brand new lymphedema if someone has morbid obesity or a lot of excess tissue. And so while eating salt alone isn't going to cause someone to swell, we just want to make sure that someone's living a healthy lifestyle and maintaining a healthy weight, and that can help improve lymphedema. And likewise, drinking too much water is not going to cause lymphedema either. Again, lymphatic fluid or lymphedema, that is a protein-rich fluid that comes from the blood. That is not from excess water that you're drinking. And truly, if we're looking at it, if someone has lymphedema, we really want them to stay hydrated. What we do know is that when someone is dehydrated in general, their lymph nodes do swell up. And what we think about with that is that there is a risk then that there is a backup of flow, there is a dysfunction of the flow through the lymph nodes, which if we want to avoid any backup of the system or worsening of lymphedema, we want to make sure that we're keeping the lymph nodes healthy. And so by staying hydrated, we can actually help the lymphatic system out. So on behalf of certified lymphedema therapists, unless your doctor tells you to scale back your fluids for a medical reason, please do not stop or avoid from drinking water just to try to reduce your lymphedema. That is not a great way to go about it. We do want someone to stay hydrated. And those are the 3 myths for today. I hope you found this information helpful. Again, if you want to see more content related to lymphedema or lymphatic health, be sure to subscribe down below. You can also follow along on Instagram or on our website. And be sure to comment down below any other topics or myths that you want to see covered in future videos. I will see you all next week for another video. Thanks, everyone.